It's 2025. The world has moved forward, embracing new technologies and innovations. Cities are more connected than ever, and life seems to be on a path of continuous improvement. Just when everyone started to relax after the devastating impact of COVID-19, a new virus is causing trouble. The memories of lockdowns, social distancing, and mask mandates are still fresh in everyone's minds. This time, the threat emerges from China. It's called human metapneumovirus, or HMPV, and it's making a lot of people sick. The virus spreads rapidly, causing concern among health officials and the general public alike. Doctors have known about HMPV for a while. It was discovered in 2001 in the Netherlands. Since then, it has been a subject of study, but it never caused a global scare until now. HMPV is related to the viruses that cause colds and RSV. These viruses are part of a larger family, known for their ability to cause respiratory infections, ranging from mild to severe. HMPV can cause breathing problems, from mild colds to serious lung infections, especially for people who are already sick. The elderly, young children, and those with compromised immune systems are particularly at risk. This outbreak in China is making everyone pay attention to HMPV and what it could mean for the rest of the world. Governments are on high alert, and scientists are racing against time to understand the virus better and develop effective treatments. The scientific community is mobilizing quickly. Researchers are working tirelessly in labs, trying to decode the virus's genetic makeup and find potential vaccines or treatments. The lessons learned from the COVID-19 pandemic are being applied to accelerate this process. Meanwhile, people are once again adapting to a new normal. Social distancing measures are being reintroduced, and public health campaigns are emphasizing the importance of hygiene and vaccination. Schools and workplaces are shifting back to virtual environments to curb the spread. The economic impact is also significant. Small businesses are struggling to survive and unemployment rates are rising. Governments are rolling out financial aid packages to support those affected, but the uncertainty is palpable. Amidst the challenges, communities are coming together, volunteers are stepping up to help those in need, and support groups are forming to provide emotional and practical assistance. The human spirit of resilience and solidarity shines through in these difficult times. On a global scale, leaders are collaborating to tackle the crisis. International organizations like the WHO are coordinating efforts to ensure a unified response. The hope is that by working together, the world can overcome this new threat more effectively. As the world faces this new challenge, there is a sense of cautious optimism. The experiences of the past have prepared humanity to deal with such crises better. With science, solidarity, and swift action, there is hope that we can navigate through this and emerge stronger. HMPV, or human metapneumovirus, usually causes breathing problems, much like a common cold. This virus is part of the same family as the respiratory syncytial virus, RSV, and can affect people of all ages, though it's particularly concerning for young children, the elderly, and those with weakened immune systems. If the infection is mild, you might experience symptoms similar to a cold, such as a runny nose, persistent cough, sore throat, and a fever. These symptoms can be uncomfortable but are generally manageable with rest, hydration, and over-the-counter medications. These symptoms typically appear 1 to 5 days after you've been exposed to the virus. During this incubation period, the virus is multiplying in your respiratory tract, preparing to cause the symptoms that follow. However, in some cases, HMPV can lead to more severe respiratory illnesses. This is especially true for individuals who already have underlying health conditions such as asthma, chronic obstructive pulmonary disease, COPD, or heart disease. For these people, the virus can exacerbate their existing health issues, leading to more serious complications. Severe cases of HMPV can result in bronchiolitis, which is the inflammation of the small airways in the lungs, or pneumonia, a serious infection that inflames the air sacs in one or both lungs. These conditions can cause significant breathing difficulties and require medical attention. Signs that the infection is worsening include wheezing, severe trouble breathing, and chest pain. These symptoms indicate that the virus is causing more extensive damage to the respiratory system, and it's crucial to seek medical help immediately. Early intervention can prevent the condition from becoming life-threatening and improve the chances of a full recovery. Anyone can get HMPV, but some people are more likely to get very sick. Babies younger than 6 months old are at the highest risk because their bodies aren't good at fighting off germs yet. Older people, especially those over 65, are also at risk because their immune systems get weaker as they get older. People with weak immune systems, like those getting chemotherapy or living with HIV/AIDS, also need to be extra careful. HMPV spreads mostly when someone coughs or sneezes. Tiny drops go into the air and can land in other people's noses or mouths. You can also get it by touching something that has the virus on it, like a doorknob. If someone with HMPV touches their nose and then a doorknob, and then you touch the doorknob and then your face, you can get sick. That's why washing your hands is super important. Like a lot of viruses that cause breathing problems, HMPV spreads more in the winter and early spring. This is a time when people tend to stay indoors to avoid the cold, creating an environment where viruses can easily spread from person to person. The close quarters and shared air make it easier for the virus to jump from one host to another. That's because people are inside together more often, and the virus lives longer when it's cold and dry. The dry air of winter can dry out the mucous membranes in our respiratory system, making it easier for viruses to enter our bodies. Additionally, the cold weather can weaken our immune systems, making us more susceptible to infections. HMPV has been found in countries all over the world, affecting people of all ages and backgrounds. From bustling cities to remote villages, no place is immune to its reach. The global spread of HMPV highlights the interconnectedness of our world and the importance of international cooperation in addressing public health challenges. But we don't know exactly how many people get sick because it's hard to test for. The symptoms of HMPV can be similar to those of other respiratory illnesses, making it difficult to diagnose without specific tests. Moreover, access to testing can be limited in many parts of the world, further complicating efforts to track the virus's spread. The outbreak in China shows us that HMPV can be a big problem, especially in densely populated areas where the virus can spread rapidly. The healthcare system can become overwhelmed, and resources can be stretched thin, making it challenging to provide adequate care for all those affected, especially in places where it's hard to get medical help. In rural and under-resourced areas, the lack of medical facilities and healthcare professionals can make it difficult to diagnose and treat HMPV. This can lead to more severe outcomes for those who are infected, highlighting the need for improved healthcare infrastructure and access to medical care in these regions. Preventative measures such as good hygiene practices, wearing masks and social distancing can help reduce the spread of HMPV. Public health campaigns and education are crucial in informing people about how to protect themselves and others from the virus. By working together and taking proactive steps, we can mitigate the impact of HMPV and safeguard our communities. Stopping HMPV from spreading is a lot like what we did for COVID-19. Wash your hands a lot with soap and water for at least 20 seconds, especially after you cough, sneeze, or blow your nose. If you don't have soap and water, use hand sanitizer. Cover your mouth and nose with a tissue when you cough or sneeze. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Throw used tissues in the trash right away. The HMPV outbreak in China is making a lot of people worried. Hospitals are filling up with sick people, and many of them have HMPV. This is especially bad in places where there aren't enough doctors and nurses. The Chinese government is trying to stop the virus from spreading. They're doing more testing, telling people about HMPV, and teaching them how to stay safe. People are using social media to share news about HMPV in China. They're posting updates, pictures, and videos of what's happening. Some posts show crowded hospitals, not enough medical supplies, and long lines for testing. This shows how hard things are right now. But remember, not everything you see online is true. Always check the news with trusted sources like the government or news reporters before you share it. The HMPV outbreak in China shows us that we all need to work together to stay healthy. Even though it's mostly in China right now, it could spread to other countries. We need to learn from COVID-19 and be ready. Everyone can help stop HMPV and other germs from spreading. Wash your hands, cover your coughs and sneezes, and get vaccinated if you can. If we all do our part, we can keep ourselves, our families, and our communities safe.